Hi, doctors. I'm Dr. Sundari from Meritus. We have Dr. Bhavika, who has cleared her RPSC exam, recent exam. So in this interview, we will share her journey and her strategy of clearing this RPSC exam. So, Dr. Bhavika, how are you?
Yes, ma'am, I'm good. How are you?
Yeah, I'm good. So, can you just tell about yourself, doctor?
So, ma'am, I did my graduation from GDC Jaipur, like Government Dental College Jaipur, and
Okay.
I'm from batch 2014, and
Oh,
I completed my graduation in 2020, like almost around 2020, and since then I was preparing for NEET PG.
mm-hmm.
Continuously preparing for NEET PG, like seriously
Okay.
for just 2 years. Then after then marriage happened, and about about this MO, like medical officer, like government vacancy, you can't predict when will it come exactly.
Right.
March 2024, like it was announced.
So what was the strategy that you practiced or you how did you prepare for this RPSC exam, doctor?
So, ma'am, since my internship, my aim was this medical officer only.
Oh, nice.
I just wanted to get into government job because my family background all are doing government job. So I
Oh,
don't have any business background, so I can set up my clinic and all. So my main focus was this medical officer job since my internship. So,
okay.
ma'am, like since 2018, last time it came in 2018. That time I got familiar with this exam, like what is the procedure, what's the pattern of the exam, and since then I was preparing for this exam, like waiting for this exam, but preparing for NEET PG actually.
Okay. So NEET MDS, you were preparing for NEET MDS continuously.
But waiting for this exam, this medical officer exam.
Okay.
So, so like for consistently, I prepared for this NEET PG, like NEET MDS for 2 years.
Okay.
Then after break, like I got married and all. Then like in between, I was studying. Like whenever I got time, I was continuing my study, but not seriously for
Okay.
any kind of NEET MDS. And NEET MDS also I was giving, but not on a serious note, like not
Okay.
preparing it 100% like that. But yeah, I was continue with my study. Somewhere I was in touch with my subjects and all whenever I was getting time. But yeah, but like 2 years I prepared very seriously. Then
Mhm.
like this medical officer exam, it got announced in March 2024.
Okay.
Since March 2024, like first week of March 2024, then exam was happened in July. Then that
Hmm.
time, from March to July, I was very continued with my study.
Okay. So you were a regular subscriber of this Meritus PSC pack. So how did our app this PSC pack helped you to crack this exam? So were the questions simulating the real pattern or how did you feel and what are the national mocks like the mocks that you attempted?
So, ma'am, as I said, I was preparing since my internship, so I have made some notes.
Okay.
Since then, was having my notes with me. So actually, I was preparing with my notes also. But then after this exam announced, I joined Meritors, and
Okay.
there was a short period of time for the preparation after it announced. So I was preparing, like notes was very bulky that time. You can't take notes and study like for one subject, one notebook was there of 200 pages, so you
Hmm.
can't continue
Yes.
with notes. But so I joined Meritors. Like it was very simplified and concise. Like every point was covered. Like subject wise was there, topic wise was there. Like then again topic. So it was very simplified and concise. So
Okay.
like we got video topics are also there. Some videos are also made on some topics. So that was very helpful for me to cover. Like it helped very much to cover this whole syllabus in a very short period of time.
Yeah. So when it comes to this PSC exams, we have both, right? The general content and the dental content. Dental content is like our syllabus, but what of the general content in this RPSC? Like there's been every year there has like every exam there are different patterns. So how was the exam for you this time when it comes to the pattern and all?
Ma'am, let me tell you one thing. Ma'am, actually, in this RPSC, like Rajasthan, actually, it is not from ma'am RPSC, it is from RUHS.
Okay, huh?
Yeah, so ma'am, there was no general knowledge question in that exam.
Okay, okay,
Yes,
okay. Only dental, right? Okay.
and
So since it is from RUHS, it is fully dental.
yes,
Okay.
yes. It's from
So
Health University. Yes,
yeah.
ma'am.
So for all
University.
the like all the RPSC's past years, we only dental question has been asked, right? When it comes to RPSC.
Yes, ma'am. Since I think 2015, it is
Okay.
only questions. They have been
Okay. Okay.
asking questions since 2015, I think.
Okay.
As my knowledge it was yes, ma'am. Only 100 questions based on dental subjects. They
Okay.
have
Cool.
been asked.
Yes.
No.
Yes. So, being a mom, how did you balance your professional time and your study time, and how did you attempt the exam and all, like when you were preparing? Because when as a student or an intern or a student who's putting a lot of efforts, this itself is difficult. But being a mom is even more challenging. So, we just want you to tell how did you even balance time for everything?
Ma'am, as I said, I was not continuing my studies properly. But
Okay.
whenever I was getting time, I was just taking my books. I was doing some questions and all, randomly doing some questions like that. It was risky for me.
Mhm.
Actually, I was not the mom at that time. I was 8 months pregnant during my exam. Like
Okay.
it was
Okay.
happening. I was 8 months pregnant and like that. So, ma'am, yeah, it was difficult, but
Yeah. Yeah. It must be very
some
difficult. Yeah.
like the notes were there. Like you just go in a simplified manner if you don't have time. I just want to say that, and don't disconnect your study completely. I just wanted to say that
Yeah.
when you get time, whatever you see, any question, any point, just read it and try to get it. Just that.
So
Don't
did you?
make your zero.
Yeah.
That's it. Hmm.
Doctor, did you attempt mocks like on a intervals, or you just had practiced this RPSC mocks only?
Yeah,
Like
I did RPSC mocks only, especially
very
Rajasthan.
yes, yes.
Rajasthan
So
medical.
you revised and parallelly you did these mocks also. You revised like you did parallelly both the things.
Yes.
So, Doctor, what's the plan after joining this medical officer? Can you tell what is the specialty of joining as a medical officer? Because not many of the students will know, right? Like, what are the benefits or what is the plan, what you can do after joining MO?
First of all, it's a government job.
Okay, so
Government
you
job.
get paid high?
Yes, ma'am. Like
Okay.
there's a pay scale in Rajasthan for medical officer. Like it is equivalent to like medical, like
Yeah.
MBBS
Yeah.
medical officer, somewhere equivalent to that. So, ma'am, like it's a like yeah, it's a like today's in nowadays government job is a dream for everybody.
True, true.
It's
Very true.
security. First of all, it gives security. Then, especially for girls, I think you can't go for clinic like that. You can't establish clinic like instantly after your internship.
Yeah.
So I think I'm not much into clinics. So that's why I think this will be good. And especially at this time, I have to manage my personal life also. So it will be
Okay.
better. I will go for clinic, like I will go for NEET MDS, but after some time, not
Yeah.
now.
So, what would be your take home message for the juniors who are going to follow your way or who have this aspirations to become a medical officer? What would you say, like in terms of preparation or whatever, schedule or whatever?
So, ma'am, first of all, I want to say like just continue with your study. Just keep your consistency with your studies. Don't skip it totally. Like I know after internship we all have personal life, we all have some other commitments also. Don't totally go away from your study. Whenever you get time, whatever you have to study, just go for it. And as you know, ma'am, medical officer exam can't come like in a scheduled way, like just like
Yeah.
NEET and can come anytime. So just prepared for it. If you are aiming for medical officer, just prepared for it, like it can come anytime. Because
Mm.
after the announcement of the medical officer, everyone will go for it, like everyone start their studies, like whoever it is. I think, ma'am, like uh, just after the internship, that was the golden period for me to for the preparation. So
So
just
basically, you're saying continue preparing, even if you have, since if you're waiting for the MO, continue preparing from where, whatever and wherever stage you are. That's the essence, right?
anytime.
The notifications can come anytime randomly. So what they have to
That-
do is they just have to continue preparing.
because after the announcement, everybody will study.
Yeah.
Whoever he or she is, everybody. Then what will be the difference between you and others? You can't be like, oh, when it will come, I will start my preparation. No, it's not like that. I
Cool.
just want to. So
So
yeah, I want to say just give 2 years, at least 2 years, for your preparation. Don't worry about the result. Just prepare yourself for even just for 2 years. Then you can do anything. Just get touched with your studies.
So all the best, doctor. We are very proud that you have cracked, you've used our Meritus PSC pack, and you are joining as a medical officer very soon. So all the best for all your future endeavors. Thank you
Thank
for
you, ma'am.
joining us.
Lovely meeting with you, ma'am.
Yeah, thank you.
Thank you.